We're going to go over intramuscular injections. The three most common sites are the deltoid. Then you have your vastus lateralis. And we'll go over the sites for this, which is right here on the outside part of your thigh, not the top part of your thigh. Also your ventrogluteal, which is down from your iliac crest, right in this area. And I'm going to show you the landmarks for each one of those. Injections used to be given in the dorsogluteal, but that is not taught anymore because of risk of hitting the sciatic nerve. So the ventrogluteal now is the site of choice. When you're using the deltoid muscle, you can give up to 1 milliliter of medication. With the vastus lateralis, you can give up to 2 milliliters of medication. With the ventrogluteal, you can give up to 3 milliliters. Another way to remember that, the deltoid has one landmark. You can give up to 1 milliliter in the deltoid. Vastus latus has 2 landmarks. You can give up to 2 mLs. The ventrogluteal has 3 landmarks. You can give up to 3 mLs. The landmark for your deltoid is your acromion process. Remember, your acromion process is the edge right here off your shoulder. You're going to typically put your index finger right at the edge of that acromion process, your third finger next, and usually where that finger is hitting right here is where your deltoid is. And there's, you can feel and tell the difference between your muscle and your subcutaneous tissue. So acromion process, index finger there at the edge, then 2 fingers, and where that finger is, that third finger, that is your deltoid. Your vastus lateralis, your 2 landmarks, are your patella and your greater trochanter. So I'm going to turn this. So say I have my patella, I'm going to put my palm of my hand at the greater trochanter. Remember, your greater trochanter is, if you were to pop your hip out like this, you can feel your greater trochanter. Go back to your anatomy, remember where that is. So patella, greater trochanter, my palm. I'm going to point my thumb and index fingers together, have them come together, and right there's my vastus lateralis. Remember, it's not on top of my thigh. If you were to divide this into 9 regions, this is your outer inner quadrant. Okay? Your ventrogluteal has 3 landmarks. Again, you're going to put your palm on the greater trochanter. I'm going to put my thumb toward the groin area. My index finger is going to go toward the as is what we call it, which stands for anterior-superior iliac spine. And then your middle finger is toward that center part of the iliac crest. Where you're going to give your ventrogluteal is where this V is. Now, if you're left-handed and you're on the right side of the patient, you can do the opposite hand where you would still have your palm at the greater trochanter. Your pinky would be toward the groin. Your ring finger would be toward the as is, or your anterior superior iliac spine. And then your middle finger still toward the iliac crest. And then it would be that V between your third and fourth finger. If you're left-handed, that V is going to be between your second and third. Okay? With intramuscular injections, typically you're going to have a 3 milliliter for your ventrogluteal, or 3 to 5 milliliter. With your deltoid, remember, up to 1 milliliter, and then your vastus lateralis would be up to 2 mLs. But this is a 3 ml. I'm going to give a ventrogluteal injection. Typically your needle sizes are usually at least 1 inch or longer. This is a 1-inch needle. With your ventrogluteal, you're going to have probably average about 1.5-inch needle. They do make up to 3-inch needles, so if you have a very large patient, that is a possibility. It will take you given injections to kind of determine what size you need. You'll in your orientation, you'll be helped to know what size and what length needle to use for certain injections. But we're going to pretend this is a 1.5-inch needle. I've got a 3 milliliter syringe. Again, I have a vial. This is a vial of morphine. We're going to say the doctor's ordered morphine for the patient to have. Again, I'm going to clean the vial. I'm going to say I need to give 3 milliliters. So I'm going to inject 3 milliliters of air into my vial. Again, air to air. Sometimes if you meet resistance, you may have to let the air come back in your syringe a little bit and then just insert it back in there. Turn it up. And I'm going to pull my medication back to the 3 milliliter mark. We have our 3 milliliters ready of morphine, and I'm going to go give my patient. Again, in the ventrogluteal. And again, in our models, we will have y'all insert air and not the actual, and we'll kind of guide y'all on that when you come in for skills, which can have air and what can have medicines. So again, with 3 landmarks, palm on the greater trochanter. I'm right-handed, so I'm going to use my left hand to hold because my right hand's my dominant hand to give my injection. Thumb toward the groin, index finger toward the anterior superior iliac spine, and my third finger toward the iliac crest center. So I know I'm going to give my injection right in here. I'm going to clean. I'm going to leave that right there. You will have your top loosened on your syringe. Now, I'm going to pull back just a little bit so you don't, we want you to do that so you don't accidentally hit your fingers when you're giving your injections. You can feel right here where I need to give it. IM injections are always 90 degrees, straight down. Again, you're going to use your wrist. I'm going to go straight in. I'm going to stabilize. I'm going to inject. And then I'm going to have still my little gauze or my alcohol swab and bring it directly out. Now, what you don't want to do with an injection is to get right at the skin and push it in. Remember, dart. You never aspirate. When we were in nursing school, you were taught to pull the plunger back and aspirate to see if you got blood tinged. That is no longer taught. So no aspirate. Again, you don't vigorously rub. You just hold that area for at least a minute. Check. If they're on blood thinners, you may have to hold it anywhere from 3 to 5 minutes. Depending on the facility where you are, you will see different type of safety needles. And it's just kind of whatever they adopt. This is that tuberculin syringe we used earlier that has a little safety catch here, that you would use that when you gave your injection, and then that would just go right over the needle, and then you would drop it into the sharps container. There are some actually needles, like with your U100, that actually has a sliding safety needle. So once you gave that injection, you would just literally just slide that up, and that covers the needle, and you go take that and put that into your sharps container. Especially here at the school and in the hospital, you will see these in patient rooms hung on the wall. You will see them in your medicine rooms. This is where you want to put anything sharp. Needles, when we learn how to break ampules, those will be sharp. They go in here. They do not go in a plastic red bag. No red bags for needles or anything sharp. They have to go in this plastic, hard plastic container. Once it gets full and you can't get anything else in there, it will show you that. And then these are taken to incinerators and disposed of.